Hi guys, welcome to video blog diary number 3, and it is November 26, 2018. So today is going to be a special day for me because today I am going to be going with my rabbi to a mikvah for a very special, hi Molly, one of my kitties. Um, she's my mama hen, can you tell? So anyway, we're going to be going to a mikvah for some special rituals for me, which are, I don't know how to explain it, but I will say this. One of the things that's key about dealing with a disease like CRPS or post-mastectomy pain syndrome or anything that is not going to go away, that you're going to have to keep dealing with, you have to treat the whole person, not just the physical ailment, not just mentally, but spiritually. We need to be treated as a whole person in order to have the best quality of life that we can have. So today's part of that for me. Is it going to be hard to get out of the house and do this? Absolutely, it's going to be. But for me, it's going to be worth it. If we can go through the pain and struggle of getting me out of the house like we have over the past month when it comes to a doctor's appointment, we definitely can do it when it comes to my spirituality. So today is definitely an important thing for me, an important thing for my quality of life. And that's key, is quality. So some people wonder still, and I don't blame you because you don't hear about it, what CRPS is. So I'm going to give you the best definition that I've seen, and this is on rsds.org, which is the National Organization for the United States, and people who have RSD, reflex sympathetic dystrophy, also known as CRPS, complex regional pain syndrome. They changed the name back in 1994 to try to better categorize it. And some people use a chart that has 4 different forms, some use a chart that has 3 different forms or types, but there's a Budapest scale that was developed to help diagnose people properly and hopefully early. Unfortunately for me, not getting diagnosed early means certain things aren't reversible. There's hope to reverse what's going on in my right chest and shoulder and arm and around my port and so forth. So we're going to wait and see when we start the treatment in a couple of weeks. So we're now about a month out from the biopsy, and unfortunately, the disease has spread, which Dr. Jorgensen, we knew it was a risk, but I knew it was a risk going into the biopsy. So I did that with eyes wide open, fully informed that there was a risk that the disease could spread by doing the biopsy. But for me, I really needed to know for certain if the cancer was back or not. So for me, it didn't really feel like much of a choice. So now I'm dealing with the repercussions, but I'm dealing with them fine. Believe it or not, there's a lot of great ways to deal with pain that don't involve taking prescription drugs or substances that alter your mind. There's a lot of different techniques that I've learned. Believe it or not, I can actually meditate in the dentist chair now, which really freaks people out, but I am really proud of that. It's taken a lot of hard work to get that far. I don't say I'm definitely not perfect, far from it. I have my moments when I am ready to be upset or frustrated or what have you, and that's just part of what comes to with the disease, and so does dry mouth. So I'm gonna take a swig here of my 1 cup of coffee I drink. That's it, just one. Okay, Dr. R. Anyway, so what can I tell you about CRPS that might help you understand it a little bit better? The definition I was referring to, CRPS is a syndrome characterized by a continuing, spontaneous or evoked regional pain that is seemingly disproportionate in time or degree to the usual course of pain after trauma or other lesion. The pain is regional, not in a specific nerve territory or dermatome, and usually has a distal performance of abnormal sensory, motor, subomotor, vasomotor, edema, and or trophic findings. The syndrome, I should say, shows variable progress over time. The CRPS occurs after any form of trauma, particularly a fracture or a soft tissue lesion. CRPS type 2 occurs after nerve damage, and type 2 is what I unfortunately have due to the nerve damage from the mastectomy and the repeated surgeries. And things that you should know. Well, it doesn't matter if you're male or female, you can get CRPS. However, women are almost a 4-to-1 ratio higher to get CRPS than men. For whatever reason, it's more prominent in women to get this disease than men. Most of the women that come down with it, the highest group, if we were to pick an age, because children get this disease too. Unfortunately, children get this. This thing doesn't discriminate. It doesn't care if you're a woman, a man, a young, old. Believe it or not, the majority are women that are in their 60s and 70s. And they're getting a disease that is considered the most painful disease known to modern medicine. There is a pain scale that all of medicine uses to basically gauge what types of diseases or syndromes can occur that will hurt you, that you feel pain, and how bad that pain can be. For example, to have bone cancer on a scale that goes up to 50 being the highest number, that's a 42. Whereas giving birth, au naturel, no drugs involved, which I did, but it wasn't on purpose. I'm going to admit that. I did ask for drugs, but I asked for them too late. Anyway, getting off track. Yeah, it's just... Oh, there it went. Yeah, that's a symptom. That's a stinky thing. But there's a lot of factors that go on. The medications that I'm on cause short-term memory loss. So does the genetics that I have. So does the disease that I have. So whatever I was just saying to you just went out the window. And I'm not even going to bother to stop the tape because I promised you guys I'd show you the real deal. Well, this is part of the real deal. I've been housebound for a little over a month now. I'm having pretty significant spasms every single day. Pain levels don't really drop below a 5. It's funny, we put me on an alpha blocker to try and help with the neuropathic pain. And it's also supposed to stop nightmares, which I'm hoping it does, because I do kind of get those, and they're not fun. The people in them are definitely not good people. But I get lost in my worlds and forget my train of thought. Yeah, the chick who used to be able to speak off the cuff from a stage can barely remember where she was in a sentence. And that's for real. I have to deal with it. So, this is the real me. So what else can I tell you? A CRPS type 2 that I have has been known previously by at least 22 other names. I also have post-mastectomy pain syndrome. I know that I am in a patient-only support group that I find a lot of really great information, and we all share about our doctor's appointments. We share when we find articles or journal articles or studies, anything that might benefit each other, we share. And this group, I had asked, what do the doctors call what's wrong with you? And I got probably close to 30 different names. And the list continues to grow. I mean, when doctors can't even agree on what to call what's wrong with you, you're already in trouble. Add to that having CRPS, which is a little known disease. There are approximately 200,000 people being treated in the United States each year. Some people will get lucky and get treated early and they'll be able to reverse it. But unfortunately, for most people, they're diagnosed too late, and you can treat the disease as symptoms. You can try to slow down progression with medications and infusions, but you can't reverse what's already occurred because it's been in place for too long and the disease has just taken hold. Now, sometimes people have an injury like I did where I had nerve injuries. Sometimes people have something as simple as a sprained ankle. Sometimes they don't even know what brought it on. It just all of a sudden starts. It's a terrible, indiscriminate disease that doesn't care about anything. Who you are, what you are, where you are. It doesn't care. Unfortunately, let's see. I want to put this in the right way. Fortunately, somewhere around 79% of CRPS patients maintain their mobility. There's a percentage that have difficulties with their mobility, and we know I'm already in that group, and we're hoping that we can make that a little bit better too. And who knows, never know what'll happen with my rituals today, and mind over matter, and mindfulness meditation, all the different things. You never know what's going to happen, right? So it's always, never say never. Unfortunately, there is no cure. There is a treatment that's had some success in putting people in remission. Keeping them in remission sometimes means repeated treatment. Unfortunately, that particular drug is only available in Italy that I'm aware of. In the United States, it's still under human trials. The FDA is fast tracking it, but not fast enough. And I'm hoping that it'll get approved and insurance companies will cover it. That's the biggest problem that we face. I'm going to be starting treatment in 2 weeks, and I've literally had to beg and borrow and save to come up with the money in order to afford this treatment. No money, no treatment. That's literally the life that we have. The treatment is not cheap. The loading doses is thousands of dollars. And the maintenance doses are every 4 weeks and hundreds of dollars for that one treatment. In addition to the prescription medications you need to take and the doctor's visits you need to go to, physical therapy, other things that you may need to do in order to keep your disease in check. Tell you a simple trick that I use. I have been on what's called an anti-inflammatory diet for years now, and it has absolutely improved my quality of life and decreased some of my pain. By avoiding foods that are like high carbs and high fats, I'm giving my body better material to work with, and I'm not aggravating my nerves. The last thing I want to do is aggravate what's already aggravated. And that's what being on an anti-inflammatory diet does, is to help you from doing that. And believe it or not, there's a really great thing that I love that's on that diet, and that's dark chocolate. But I avoid other things, like I don't eat a lot of red meats, and I don't drink. I don't eat a lot of sweets. I eat a ton of salads, but my style salads. I'm not big into lettuce, but I love spinach and kale. Great sources of iron. And I take supplements like calcium for my bones, vitamin D3, a multivitamin. Fish oil is very important to get the omega-3s. So there are things that we can do ourselves by altering our diet and lifestyle that can help reduce some of the pain. Does it make it go away? No. There's a great deal about dealing with this that has to do with, I don't want to say getting used to it, because you don't ever get used to this. You really don't. I'll say that you become a more skilled warrior. You learn what kind of tools to put in your toolbox and what to take out when you need it. I have a therapist, and I know to take her out when I need a tune-up, and that's okay. I also know that she's a great resource for learning different mindful techniques in order to help me get past the pain in my mind by using my own mind, which is totally great scientific method. Think about this. If you had to think about breathing, and you literally had to think, inhale, and how much you would inhale, maybe you would count 4, 3, 2, 1. If you had to think, exhale. While your mind is thinking about those things, it's very hard for you to think about other things, like pain. So you're basically using a distraction technique that's beneficial to your respiratory system and helps to keep your cardiovascular system in check and not working on overdrive because of the amount of pain that you're in. Does that mean that my blood pressure doesn't run high? Oh, hell no. I woke up this morning at 144 over 96, despite the medications that they have me on, including a beta blocker. I still had a high blood pressure when I got up this morning. And that happens, and it's from pain, and I accept that. But I also know that if it continues, my doc would probably want me to give them a call. So I keep in contact with them and make sure that I'm taking care of my body in the best possible way, because that is the way to have a quality life and a long life. I am not wanting to die anytime soon. Will this disease take my life? Yeah, maybe, probably. So what? Something takes all of us, right? We are progressively dying every single day. I mean, one could argue. Do you have to have a label on you that says progressive? No, you shouldn't. So take it from me, who has a label. You don't need a label. You don't need a label. You need an attitude adjustment. For me, it took taking a look in the ugly mirror and seeing the parts of myself that weren't so great and wanting to change them from deep within my heart. It's not just something you think about. It's something you feel in your very core of your being. It's something that gnaws at you in a way that you detest that piece of yourself, that you want to fix it. See, we don't get rid of our negative side or our negative inclinations, as my rabbi would say. They're there. They're always there. But we have positive inclinations. And it's who we choose to listen to. There's a Native American tale that talks about the same concept and compares it to two wolves. So the negative and the positive are the two sides of you are these two wolves. And they're battling to have the food that's available. And the grandfather is telling the grandson about these two wolves battling to have the food. And the grandson says to the grandfather, "Well, which one wins, Grandpa?" And he looks at the child and says, "The one that you feed." Well, I was starving the good side of me for a pretty long time. Not entirely. There was still goodness in me. Don't get me wrong. It's not like I went totally evil or something. But, boy, I could have a bite with my tongue. And definitely didn't understand why I would find it so hard to keep in check in certain situations. Now that I understand CRPS, I understand it better. But I understand that how to control it better too. It's not an excuse. It's just an indication to help you learn which way to go. If I can leave you with that, I would leave you with that thought. We all have to learn what paths we have to take, and sometimes that means we make mistakes. And it's okay to make mistakes, as long as you recognize it, repair it to your best of your ability, own it and apologize, and move the heck on. Leave it all behind, because there's absolutely nothing you can do to change whatever happened yesterday. What you can do is change what happens in this moment. And in this moment, I'm going to go get ready to go to the mikvah with my rabbi and heal the spiritual side of me and be a better woman for it. Love and light. I love all of you guys. Mwah. Thank you for traveling this road with me. And I hope all of you have a wonderful, happy, joyful day. God bless.